Good morning. This is Professor Sugar, and today I am going to talk about is teaching for learning in clinical setting, word-based teaching. This is very important because in health professional education, teaching in hospitals, teaching in ward is an important component. And this corresponds to chapter 13 of a book which is Teaching for Learning in Clinical Setting. The most important triad is learning triad from the perspective of teaching and learning. The triad of patients, students and teachers. Patients, suitable patients for clinical teaching should be carefully selected. We can't teach on every patient because teaching is according to instructional objectives, specific learning outcomes. So accordingly, you have to select the patient on which one want to teach. Optimal number for teaching in clinic is 2 to 5. You realize this thing, that there are certain characteristics which promote learning, which are face-to-face interaction, active participation with each and every one, which are the most important, and being patient over there. And we also know this thing, on a patient, we cannot engage patient for a longer time period because patient will get tired and it's not ethically acceptable. So 2 to 5 is the optimal number to listen, observe, question, demonstrate, problem solve and participate. The teacher should have appropriate knowledge, appropriate skill and appropriate attitudes to teach. Interestingly, the teacher should not only have the appropriate knowledge of the disease which he is teaching, the teacher should have appropriate knowledge of the patient also, on which the teaching is going to occur. Not only this, the teacher should have appropriate skill, not only the clinical skills, but also teaching skills. There are many methods by which the teaching is done in wards. One is teaching ward round. Students are taken to a small number of selected patients for opportunities to see physical signs and hear aspects of case history. Opportunities for students to interview patients and demonstrate examination techniques. Classical method which is used. The students are taken to patients which have been selected previously of what you want to teach to them, and there is a small number of students also, and they go, they see the appropriate physical signs, they interview they do take history, they do physical examination, then they discuss. So the opportunities are there for the students to interview patients and demonstrate examination techniques. What are the methods? One method is demonstration model. In demonstration model, teacher demonstrates aspects of the case, history and physical examination and student observe. So therefore, if there are 4 or 5 students and this is a patient in line, we go to the patient, he's standing around the patient, and it's the teacher who is demonstrating aspects of case history and physical examination and students are only observing. And by active listening and observing, they're learning. In teacher model, teacher stands to the patient's side and critiques each student. Students in turn interview the patient and carry out aspects of physical examination. So a task has been explained to the student by the teacher. Now teacher is standing on site and students turn by turn, they are performing the task. Like the task could be, okay, well, you go and first you take relevant present history and then somebody give points and then examine. And whenever a student performs, then a feedback is given by the teacher. To repeat, in teacher model, the role of student is students in turn interview the patient and carry out aspects of physical examination, and teacher role is he stands on the patient's side and critiques each student. In observer model, the role of teacher is he distances himself from the student-patient interaction and observes each student interviewing and examining for a longer time. Feedback is provided at the end as the student discusses the case. And the student's role is students in turn interview the patient and carry out aspects of physical examination. They then discuss the case at the end. And now the teacher also joins in, listens to them and discusses. And the fourth is a report back model. The teacher role is not to supervise the student. Student is, they take a history, examine a patient without supervision and report back to the teacher later in a side room. They present the case and receive feedback on the content and delivery, because the teacher already knows the case which he is giving, what is the history, what are the findings and these things. So the teacher does is, he says, okay, go to bed number this, take history, and then come back to my office or this place. And then they come back and then they present their history and examination findings, and the teacher then does a critique and gives them a feedback. So just to revise, in teaching word round, certain methods are used. One is demonstration model, in which students are silent and doing nothing and teacher is only demonstrating. There is the teacher model, in which teachers stand on the side of the patient and students in each turn are interviewing or examining, and to each student continually the teacher is giving feedback. Observer model, the teacher is standing there and observing but not interfering, but once these students are finished, then they reconvene and they start discussing, the teacher giving feedback and critiquing. And in report back model, the teacher is not present at the time when the students are examining and taking history of the patient. Another very useful method to teach in clinics is 1 minute preceptor, especially when there is so much busy OPDs and rounds, and they are, because of legal considerations, the involvement of students actually seeing the patient becoming less, and the result is they are developing hyposchilia now and so problems arising. 1 minute preceptor is a very good method of teaching. It consists of 5 steps of micro skills. One micro skill is get a commitment from the student about what they think is wrong with the patient. Another micro skill is probe for underlying evidence to support their opinion. Third micro skill is teach general rules. Fourth micro skill is provide positive feedback. And fifth is correct error. Mind you, these are micro skills. Skill is ability to do well, so teacher has to learn how to get a commitment from the student, how to probe for the underlying evidence from the student, then how to derive the general to teach them, how to provide them a positive constructive feedback, and how to correct errors. In getting a commitment, which is a micro skill first used, the teacher encourages learner to articulate the opinion on the differential diagnosis and management rather than giving their conclusions and plan. must create a safe learning environment so the learner feels safe enough to risk a commitment even if it is wrong. So therefore, instead of asking directly, you can get a commitment by asking, okay, what do you think the patient has? What do you think the disease he could be having? Have you seen his eyes? Is there anything wrong? So what's the differential diagnosis? Then again you can commit out of this why you think she has, or then commitment, what is the best investigation do you think she should have, or what investigation should be done and how it should be managed? So when a student commits, then prove for the evidence. Encourage learners to think out loud and give their rationale for the commitment they have just made to diagnose, treat, or other aspects of patient problem. Should either validate learners' commitment or reject them gently flawed. So, if says that this is a clinical finding, so why do you say this is a clinical finding? Why do you say this is the diagnosis? Why you should do this investigation? And then the learner is going to think aloud, the student is going to think aloud and tell you his reasons, his evidence. If he is telling correct, you should validate it. And if the evidence he's presenting is wrong, then you should gently tell and reject it. No, it's not like that. Teaching general rules. Teacher can guide learners to understand how the learning from one patient can be applied to other situations. The learner is primed for new information they can apply to a given patient and future patients. So therefore, one of the skill is when you're doing 1 minute preceptor. Preceptor is, by the way, is another name for the teacher. Is from there you can bring out a general rule which he should learn, a general principle which he can apply. To give you an example, let us say there's a patient and I say examine abdomen and somebody says and McBurney point to test is present, which is an acute appendicitis. Then in the end I can always, general rule, look, any patient who comes with abdomen and their McBurney and at McBurney point there is tenderness, then one must keep acute appendicitis in the top list of differential diagnosis. Reinforce what was done well. It is appropriate to use these micro skills every time the trainee has handled a patient case well. Effective reinforcement should be specific and behavior based and not vague. Positive feedback also builds the trainee's self-esteem. If the learners have performed well and the teacher has nothing to add, these micro skills can be skilled. Now this is very important. You see, we have taught 1 minute preceptor, and 1 minute preceptor simply means 1 minute teacher. It means the whole teaching session is going to take few minutes. These are micro skills. Getting a commitment, probing for evidence, general rule, and so on and so forth. Now, it's not essential that all micro skills should be practiced in one session of 1 minute preceptor. Obviously, there are two micro skills which will always be practiced. One is getting a commitment and probing for evidence. But next three, depending upon the performance, one may omit one may not spend much time on one, or vice versa. I hope this teaching session helps you in learning. Have a good day. Continue to smile. Have fun. Bye-bye. May peace be upon you.